Thank you for joining Good Samaritan Spotlight. My name is Adam Thacker. I'm the Chief Operating Officer, and I have with me Matt Sievers, Senior Physical Therapist here at Good Samaritan, and really excited to talk about physical therapy, the benefits, when to seek it, just education to the community, really a kind of behind-the-scenes heroes and getting people back to their daily lives, and a lot of education as well. Because I think many times we think of physical therapy as I had a surgery and now I have to rehab, but it's so much broader than that. So I will let you as the expert kick things off and tell us, so what is physical therapy?
So you broached the topic a little bit, right? Physical therapy can be preventative. It could be you have it after a surgery. It could be that you wake up and you're a certain age and your neck hurts just because you woke up and you need to come in and see us. So physical therapy can help a wide range of people. For the most part, we are helping get back to a level of function that they need in their life to have an improved quality of life.
And we provide physical therapy to what ages?
At Good Samaritan, we provide physical therapy to across the lifespan. So we have pediatric patients at our outpatient clinic. We have sometimes we have children under a year old, and then we also provide within outpatient, inpatient rehab across all the lifespan, even to the end of life. So from birth almost to the end of life.
Okay. And I know there are times we think about physical therapy and will it hurt? So from a physical therapist standpoint, you're pushing the body and increasing range of motion and movements, whether post-injury, post-surgical, or just healthier. So talk maybe a little bit about that misconception of pain and that there's a place for it.
Sure. So a lot of people like, they know the saying, no pain, no gain. That it's yes and no within physical therapy. Like you mentioned, after a surgery, there's some surgeries like a knee replacement. We really got to push that range of motion. So there's going to be a little bit of temporary pain, but it's for a greater good. It's not for no reason. There's a goal that we're trying to reach there. So that's definitely there. But in terms of the pain aspect, it's not always no pain, no gain isn't necessarily always the case, right? We're hoping to push things, but we also don't need to just push and push until somebody, breaks.
Right. And I think that's the difference between coming to Good Samaritan, seeing our trained physical therapists who have went through years of rigorous schooling versus I looked up Google, said do these exercises post knee replacement, and I'm just going to go home and do them. You know those thresholds and how to safely push the body versus the just doing it on your own.
Right, absolutely. With physical therapy, being a doctorate now, all of our physical therapists at Good Samaritan are doctors of physical therapy. So a lot of schooling, a lot of education, a lot of years of practice there, exactly, to know that fine line of are we pushing enough first? That's good.
Right. So from a patient standpoint, can patients self-refer to our physical therapy? Do they go through a physician or other provider? How does a patient get set up with physical therapy?
So within the outpatient setting, there are 2 to 3 kind of options. There's the traditional option, like you mentioned. Your shoulder hurts, you go to see your doctor, they take some images, they say, hey, it's okay, let's go to physical therapy, and they write the order for physical therapy. So that is an option. One of the newer options in Indiana, we're allowed to, so still billing insurance, you can come see a physical therapist without an order from your physician for up to 42 days. That's called direct access. Every state is a little bit different, but in Indiana, that's the case. Now, the caveat there is not every insurance accepts that. So sometimes people don't just, walk in the door. They'll give our office a call. That is something that we're trying to educate the public more about, is that you don't have to go through the steps of, going to see your physician, paying that copay, getting the x-ray. That's the reason of that doctorate degree, is you can come see physical therapy, and we are trained to know, hey, is this something that's musculoskeletal that we can treat? Or, hey, maybe this is referred from an organ. You need to go see your physician. So that's also an option. Like I said, there's some insurances that cover that, some that don't. And our receptionist and insurance team are great at being able to point that out.
Right.
The other option that we have within our outpatient department is we offer wellness visits. where you can come in if you haven't seen your physician, like I mentioned, you just kind of woke up and your neck hurts. You can come in and see us, and we're able to take a look at your symptoms, see what you got going on, see, hey, do we think this needs formal therapy? They need to see a doctor, or can we see them once or twice and kind of nip this in the bud? And those visits are out of pocket. That's not billing insurance.
So let's dive into that a little bit more on the insurance side. So you have the wellness, which is a cash-based option. And then we have physical therapy is covered by most all insurances that we take across Good Samaritan. Does that require a prior authorization, or is it covered just kind of inherently by most insurance?
So yes, most insurances do cover it. Every insurance is a little different. Most of them require what's called pre-certification. So you come in and see us. Your insurance will say you can come see us for your evaluation. We say we see that and we write your plan of care. You need this, this, and this. See you for this long, etc. Then your insurance has to approve it. So some insurances we can just go ahead and get you scheduled on, like Medicare, for instance. We're fine. We can just go ahead and get you covered, get you seen. Of course, Medicare is one of our big payers. There's some other commercial insurances that have moved to that pre-certification, so there might be just a short gap, but not too long.
Sure. So important for our patients to understand their insurance and what is required. And as you stated, we have a team of individuals that are looking at that. So if we miss that step, somebody will jump in and say, hey, we need to get this pre-certification.
Yeah.
And on the wellness side, I would be remiss if I didn't say I am a recurring patient of Matt's on the wellness side from that preventative approach. And I think that's also an aspect of physical therapy that gets overlooked. It's not post-injury, but there are preventative approaches that we can do to stay healthy and keep our bodies from those injuries.
Yes, absolutely. And that's definitely a growing kind of subsection of physical therapy, the cash-based side. So definitely excited that we're able to offer it. We've been offering it for 4 to 5 years now, and it's definitely growing. Like you had mentioned, preventative. I see people who aren't necessarily injured. Like I see athletes who throw a whole lot, and so they just come and see me every 3 or 4 weeks just because they know that the overhead motion isn't very nice to our shoulders and our elbows. And so I see them and we work on them just to try to keep them healthy so that they don't have to come see us for that formal therapy or have some sort of injury or increased pain.
Great. So some other modalities that patients might look at in a similar, like chiropractic, how does physical therapy differ from chiropractic or a chiropractor that they may go see in that type of care?
I would say the biggest difference is chiropractors are very hands-on, just like physical therapists. And there's other different wellness shops, and things like that, acupuncture, things of that nature. I would say from an overall standpoint, physical therapy is looking, there are hands-on things, but there's also exercises and things that we can do at the moment to help you, but then also things to give you kind of for your toolbox at home, exercises, stretches, things like that hopefully help, keep you, sounds bad, but keep you from physical therapy, keep you healthy so that you don't need to come see us from that standpoint. So treating you in the moment, getting you better over a week, a month, whatever you had done or whatever you have going on. So hopefully where you're able to take care of it yourself.
And your physical therapist will know if you are doing the exercises or not. Trust me, they will call you out if you are not. So follow the therapist's instructions. Anything else that you'd like to cover regarding physical therapy? Maybe let's go over where you're located. How would a patient self-refer for that direct access?
Sure. So within our outpatient departments for the direct access, we have a clinic here housed within the campus of the hospital, Benson's Orthopedics Physical Therapy. My clinic, we're out at the Clearview Clinic, so that's across town, across Lincoln, across Hart Street from Lincoln High School. And out there we have the outpatient physical therapy as well, occupational therapy and speech therapy, as well as our sports performance side. So giving us a call out there, that number is 812-885-3011.
And on our website, can also look up all of the information for physical therapy and locations and do a little bit more research into all the services that are provided.
Yep. We have a Facebook page as well.
Okay.
Good Samaritan Center for Therapy and Sports Performance Facebook page.
Excellent. All right. Anything else you'd like to share?
I don't think so. I appreciate you having me on.
Well, thank you. Appreciate all the information, and I'm sure that you're going to have those direct access referrals rolling in now as patients look at physical therapy and a little bit broader scope than just my surgeon said to go there after I got a new knee.
Yep, absolutely. We hope to be very busy. That'd be a great thing.
Right.
Yeah.
All right. Thank you for joining Good Samaritan Spotlight.